And we are here once again with El Señor Mejia from the County of Sonoma, who comes to us and talks with us about what's going on with COVID and the vaccine. And once again, we're here and we want to know what's the update, specifically now that children 5 and older are able to get vaccinated. So thanks again for taking the time. Can you provide us with an update to our community about what's going on?
Absolutely, with pleasure, Rafael. Let's start that by saying that the vaccination for kids 5 and 11 is now in the second week since we began, and we have so far vaccinated 4,800 of our children here locally. So that's an impressive start for the pediatric vaccine. So the scope of these children is slightly more than 37,000 children in this age group, 5 to 11. So it's a great start. We are seeing that a lot of parents are really enthusiastic and we're really longing for this time to arrive and finally vaccinate their kids. All of this is happening in this context where the number of cases at school just continue growing since we began the in-person classes with 888 cases, mostly in elementary schools, mostly affecting kids. 791 students reported so far since the classes began. So this is worrisome, and the vaccine is a great solution to protect these kids, to prevent all this disruption in the continuity of their classes through constant quarantine because this or that kid was exposed or got infected, and we need to control this. So now in all California residents age 5 and older are eligible for the vaccine. That is very important too. So with all these kids that I was mentioning, we're nearing 13% of this population. So we are hoping that it continues that way and we reach our goals to have 25% of these kids vaccinated by the end of the year and 75% of them by the end of February next year. So looking at our county as a whole, more than 379,000 residents have received at least one dose. That is 76.8% of the county's total population. Again, we're getting closer to that 80%. That is one of the components to allow us to remove masks, along with other two, which is keeping the number of cases low, less than 50 for every 100,000 inhabitants in a period of 21 days. And the third component is to have a low number of patients in hospitals. We're doing a steady progress with the vaccination, and I hope that this last 10% that we're working on allow us to get to that 80%. It's good for the kids, it's good for the families, it's good for the society as a whole. I mean, this is very significant to get us to the closest possible to life before COVID. There are now 470,000 vaccine eligible residents as a base to vaccinate, that have been vaccinated. The expanded number of eligible residents means that 80.7% of our population 5 and older is now fully or partially vaccinated. I'm talking about hospitalizations. As of Tuesday, 21 COVID patients were in Sonoma County hospitals. This included 6 patients in the ICU beds. The unvaccinated people continues to be the most affected time. According to our epidemiology data, they are now 27 times more likely to be hospitalized because of COVID. Fully vaccinated people who test positive for COVID-19 are oftentimes asymptomatic and rarely end up in the hospital. So we've been talking here in your show about the progress of vaccination and discussing how the younger people is the most affected and the less vaccinated. So I want to give our audience an update about these groups. The the group 12 to 15, it's only 62% vaccinated. They began in May, so they began late in the year compared with everybody else who began in being eligible early in the year. The next group, 16 to 24, are almost 71% vaccinated. The next one, 25 years of age to 34 years, is almost 72% vaccinated. And the residents between 35 and 44, almost 82% are fully vaccinated. But you see, that's a constant thing in this group. Nearly 30% is not vaccinated yet. We keep moving at 1% pace, and this is the area where the virus keeps affecting people, infecting them, with asymptomatic or with symptoms or with really bad symptoms or with hospitalizations or worse. All these people continues to be affected, and we all keep being affected as a society because of COVID, including the vaccinated people. I want to report that the post-vaccination cases since the vaccination began are up to 4,287 cases for residents fully vaccinated. And this represents 1.2% of the populations who has been vaccinated, fully vaccinated. At the national level, the United States has recorded now 763,000 deaths for COVID. So COVID is still there, hasn't gone anywhere. And the United States still has an average of 85,000 new cases per day and an 18% increase in the past 2 weeks as we approach the winter, and an average of 1,100 deaths per day. So now with the vaccinations for kids, I'd like to share with you several of the schools that are open this week. First, I'd like to invite the people who's listening to visit a website, the website of the Office of Education, or SCO, and that is spelled SCOE.org, where you can see a complete list of the schools where all these vaccinations are happening. These are elementary schools for this age group. Those clinics are planned for the students of those schools and their families. Most of these clinics are going to have the pediatric vaccine, but also first doses or second doses for all of those persons 12 and older. So entire families can come and get the vaccine, including some of them the flu vaccine, and boosters are also going to be available. So let's begin, since they're almost closing for today. Let's just mention the ones that are tomorrow, the 19th. There is one in Sonoma, it's the Adele Harrison Middle School from 4 to 6. Then there is another one tomorrow in Santa Rosa, the Stilly Lane School. And then that's one from 1 to 4 o'clock. And the next one is the next week on Tuesday in El Verano School, that's located in Sonoma from 3 to 7:15. There is no need to bring any form of ID. There's no need to have immigration papers to get the vaccine. The vaccine is free of cost and is for all members of the family who want to attend these events. So that's a great asset to have and a great opportunity for families to continue with their vaccinations. We have 2 pieces of information in the form of webinars that we host as a county and in association with the Sonoma County Office of Education, where we invited doctors and pediatricians to talk about the vaccine, and the materials are available for people who wants to watch them. We had on Tuesday the version in English. On Wednesday we had the version in Spanish, and both of them are available in both our Facebook page and our YouTube page, so you can see more details there. And finally, I'd like to give you an update about boosters, which is another area of vaccination that is making amazing progress too. The county has expanded eligibility now for every adult 18 and older. And that's following the guidance of California as a state, where statewide it's open for everyone to receive a booster who wants to have it. Boosters are not mandatory. I've been asked if they are mandatory. They're not mandatory. Is your choice to do it or not. We are doing only recommendations, especially for those groups that are more affected, 65 and older, people who is suffering underlying comorbidities, people who has a history of bad health, just to say in a few words. And for all of those that are exposed to high risk jobs, have a lot of exposure to the public, like in those essential workers, especially, that have been most affected. For all of those who receive 2 doses of Pfizer or 2 doses of Moderna, you have to have a 6-month distance since you had your second shot. And for those who had the Johnson & Johnson vaccine, you have to wait 2 months since your shot to get your booster now. And we have talked here before that now you can mix and match, especially for Johnson. There is a trend that is indicating that Moderna combined with Johnson elevates the protection up to 94%. Some other students are even higher than that. But let's remember that Johnson & Johnson was the lowest rate of protection that was being offered. To do these appointments, we are recommending people to visit their primary care providers or get the vaccine in your local pharmacies by visiting myturn.ca.gov, where you can make your appointment. We have provided so far 65,000 boosters, and almost 40,000 of those have gone to seniors 65 and older, which is now approaching 48% of this group in such a short time, since September to now. 65 and older people responding so well to the vaccines. More than 25,000 boosters have been administered to residents under 65 years of age. And that's a lot of progress. And that concludes my report.
And as always, I appreciate that you take the time. You spend some time with us every week. You've been doing it for some time now on behalf of the County of Sonoma. And again, just reminding the community, when you go and listen or watch these videos or participate in any type of training in regards to the vaccine, you will always see people who are making comments to try and create chaos, to try and create confusion. Again, you can always start with your pediatrician. If you trusted your pediatrician for all these years to be able to take care of your child, this is the time that you go with your list and you say, this is what I heard, this is what I seen. Can you clarify that? And after that, get the shot for your child. If you trusted them for this long, continue to trust them. And with that, I want to thank you as always for taking the time, Senor Mejia, and I look forward to our next conversation next week. Thank you.
Thank you. Have a nice weekend. See you next week.
Bye-bye.
Bye.